PTSD affects people who experience extreme trauma. Combat veterans, assault survivors, emergency responders, accident victims. The disorder was first formally recognized after the Vietnam War, when thousands of returning soldiers struggled with what was then called shell shock. Today, researchers estimate that millions of people worldwide live with PTSD. Traditional treatments include antidepressants like Sertraline, anxiety medications, cognitive behavioral therapy. But these treatments don't work for everyone. In fact, studies show up to 1/3 of patients remain severely affected even after years of treatment. For them, trauma is like a locked door in the brain, and no one had the key. To understand the story, we have to go back to the early 1900s. MDMA was first synthesized in 1912 by the pharmaceutical company Merck. At the time, nobody knew what it did. Patients who took small, controlled doses during therapy sessions became less afraid of their traumatic memories. They could finally talk about things they had avoided for years. But in the 1980s, the drug exploded into nightlife culture. It became known as ecstasy. Concerned about abuse, the U.S. Drug Enforcement Administration classified MDMA as a Schedule I drug in 1985, meaning it was considered to have no medical use. Scientific research nearly stopped overnight. For decades, the idea of using MDMA as medicine seemed impossible. But one organization refused to give up. The Multidisciplinary Association for Psychedelic Studies, also known as MAPS, spent decades trying to prove that MDMA could be used safely in therapy. Researchers began conducting carefully controlled clinical trials. Patients didn't take the drug at home. Instead, they received 2 or 3 supervised sessions, each lasting about 8 hours. The goal wasn't to numb the trauma, it was to process it. And the brain reacted in a fascinating way. MDMA dramatically changes how the brain processes fear. Normally, traumatic memories trigger the amygdala, the brain's alarm system. This structure detects threats and floods the body with fear. But MDMA reduces activity in the amygdala. At the same time, it increases communication with the prefrontal cortex, the part of the brain responsible for reasoning and emotional regulation. The drug also releases large amounts of serotonin, dopamine, and oxytocin. These chemicals create feelings of safety, trust, and emotional openness. In therapy, that combination becomes powerful. Patients can revisit traumatic memories without being overwhelmed by fear. For the first time, they can process what happened, instead of reliving it. In simple terms, MDMA allows the brain to reopen a memory file and rewrite how it is stored. The results stunned scientists. In one large Phase 3 clinical trial conducted by MAPS, patients with severe PTSD underwent 3 MDMA-assisted therapy sessions. The outcome was remarkable. After treatment, about 67% of participants no longer met the diagnostic criteria for PTSD. Many patients reported life-changing improvements in relationships, sleep, and emotional stability. Some had suffered from trauma for more than 20 years. And yet after just a few sessions, symptoms dramatically improved. Compared to traditional antidepressants that must be taken daily for years, MDMA therapy involves only a handful of supervised sessions. This is one reason researchers believe the treatment could revolutionize mental health care. Most PTSD medications work by suppressing symptoms. Antidepressants reduce anxiety. Sedatives reduce panic. Sleep medications reduce nightmares. But they rarely resolve the trauma itself. MDMA therapy works differently. Instead of dulling emotions, it creates the psychological safety needed to confront them. 3 key reasons researchers believe MDMA therapy may be more effective. 1. It reduces fear during trauma recall. Patients can talk about painful memories without triggering extreme panic. 2. The surge of oxytocin enhances emotional connection, which improves therapy outcomes. 3. It promotes long-term emotional processing. Instead of suppressing trauma, the brain reorganizes how the memory is stored. In other words, the therapy doesn't just treat symptoms. It may actually heal the root of the disorder. Because of these results, regulators began taking the research seriously. In 2017, the U.S. Food and Drug Administration granted MD-assisted therapy breakthrough therapy status. Researchers are now exploring similar approaches using other psychedelics, including psilocybin, the active compound found in psychedelic mushrooms. If you found this video interesting, please like and subscribe to the channel. We have a lot more coming.